Few weeks ago, we talked about the importance of this water surrounding baby during pregnancy. And this water, baby needs it for survival. And in that video, we talked about how some women will be leaking this water in pregnancy and they're not even aware they are leaking this water. So if you've not watched that video, you can go right ahead and watch that video. So in that video, some people ask what could just suddenly reduce the water surrounding baby in the womb. And that is what I'm going to be answering in this video. When it comes to this water surrounding baby in pregnancy, there are so many things that can cause it to reduce while a woman is pregnant. And some of these things, you can control some of these things, while in some cases, you may not be able to control some of the causes. So one thing that can cause this water to reduce, just look at this bag. This is a bag of water. For instance, you're given a bag like this. One thing that can suddenly make this thing reduce in quantity is that you puncture the bag and the water starts leaking out. And that is what that video was talking about. The woman is just leaking water. So when a woman is leaking water in pregnancy, this water can reduce and this baby is going to be at risk. But there are instances this one is not leaking water, she's not seeing water, she's not leaking water, but this water surrounding baby is just reducing. Another thing that can cause this water surrounding baby to reduce is that if a woman is having womb infection, she's having infection in the womb, it can cause the water surrounding baby to reduce. Another thing that can make this water to reduce is hypertension in pregnancy. If a woman is having elevated BP, preeclampsia, if she's having elevated BP in pregnancy, the water surrounding baby can reduce. Another thing that can make this water surrounding baby to reduce is diabetes in pregnancy. Elevated blood sugar in pregnancy can make this water reduce. If you're not having adequate nutrition in pregnancy, you're not eating good food, you're not eating good things that can nourish your body. I'm not talking about junks or eating things that can make you fat. No, you need to nourish your body. Essential food, essential nutrients that your body needs. For those who have bought our book that talks about how to eat in pregnancy to maintain a healthy pregnancy, all of those things have been discussed in that book, How to Eat in Pregnancy. If you're not eating food that contains essential nutrients in pregnancy, it can make the water around the baby to also reduce. The thing that can make the water surrounding the baby to reduce is that there's a problem in the baby. The baby is not developing well. The video we posted about 2 or 3 days ago that talked about the day in the life of a baby in the womb. If you go and watch that video, we talked about how babies swallow amniotic fluid. They swallow this fluid and urinate this fluid. So for babies whose kidneys are not properly formed, they end up not urinating. And when that happens, this amniotic fluid is going to reduce significantly. So this is also a sign that the baby is not forming well. There's a problem with the baby's kidneys. So when it comes to things that can make this water reduce, as much as you can, you want to protect yourself from infections. If you've been told that you have elevated blood pressure, elevated blood sugar, you want to ensure that those things are regulated. There are some factors in the baby that you may not be able to control. Your nutrition is very important in pregnancy. All of those things are things you should put in check as a pregnant woman, and always discuss with your doctor whenever you go for your antenatal. There are times a woman will start leaking this water, and that is a sign that your water is reducing. But there are other times when she's not leaking water, yet the water is reducing. So there are signs a woman should look out for. One sign that may indicate that the water surrounding the baby is reducing is that your bump is not growing. You're just pregnant, but the bump is not increasing in size. So another thing that can be a sign that this water surrounding baby is also not enough is that as a woman in pregnancy, you should add up some weight. So if you notice that as you're pregnant, you're not even adding weight at all, rather you're even losing weight, it could be a sign that this water around baby is also reducing. Sometimes it could be that you're noticing that your baby that used to kick before, the kicks are reducing. You're no longer feeling baby's movement as you used to feel baby's movements before. That could be a sign that the water surrounding baby is also reducing. Like I mentioned initially, some women will just be leaking water. That is a sign that this water is already reducing. Another way to also find out if this water is adequate is by doing a scan. So your ultrasound scan can always show if this water is enough or not. When it comes to the water surrounding baby, it's important as a pregnant woman, you know the signs to look out for in your body. It's also important to also pay attention to things that can cause this water to reduce. Like we mentioned, high blood pressure, elevated blood sugar, poor nutrition in pregnancy, infection of the womb. All of these things can cause the water surrounding baby to reduce. So it's important as a pregnant woman, if you fall into any of these categories in your pregnancy, it's important your pregnancy is monitored closely. It's important your blood pressure is monitored, your blood sugar level is monitored. If you have infections, it's important those infections are treated, because all of these things can put the baby at risk and even put you, the mom, at risk. So I hope this video is explanatory and I hope this video is helpful to someone. So see you in our next one. Until then, bye.